Hi, I'm here again with Dr. Lacara, and we're going to give you a quick sort of run through on a sort of nice daily workflow to do early in the morning as soon as you get up. I do it every day. I generally do some sort of resistance training as well, just with using a rig or some very light weights. Initially I just use kettlebells, but in the days I'm not doing that or I just want something lighter, this is the routine I would use. So I'm going to start off on doing these neck exercises. I'm hoping Raoul's going to sort of butt in and tell me what I'm doing here.
So you've got neck flexion and neck extension. When Tom moves his chin really far forward there, he's actually giving the deep neck flexors a really good stretch. And often when people have neck pain, the deep neck flexors are one of the problems. And he's also giving them another good sort of loading exercise when he's pushing his chin really far back. So that's really eccentrically loading it, and we call it. Basically, it's loading those neck flexors under stretch.
So I don't tend to say do 5-10 reps. Do until it feels like it's free. So the next one I'm going to do, I do find I struggle a little bit, and obviously I'm a dentist. I tend to have my head down a lot. If I'm looking on my scope, I might hold a funny shoulder position. So I tend to get a bit of tightness in my shoulders and find they're a little bit restricted. So I'm just doing that until I can, basically I'm picking a point on the back of that behind me until I can see it.
So Tom's pushing to his limit, and then he's gradually seeing if he can push past it, but he's not being too aggressive. So don't feel you have to really push hard to get to where you want to be. And I think as people, we're all asymmetrical. We've all got different ways of doing things mechanically. Some are right-handed, some are left-handed. You can automatically see that Tom's got reduced range of movement on the right side.
Yes, I was just about to say how I'm struggling a little bit, but you've got it straight away. So I've had a little tightness here down this right hand side, and I've had it pretty much every day for the last month. So even with all these things I do to try and help improve my sleep, doing regular gym exercises, I still get, just because of my job, it's a very manual job being a dentist. The way position we seats, I still get tweaks here and there, but I don't let those tweaks turn into big flares as much as I used to, because I can't afford time off work, or I can afford it, but I don't want to have it. So shoulder rolls now.
So this is really good for the lower neck, but also the trapezius muscles, the rhomboid muscles, the upper back muscles. Part of Tom's movement will be isometrically loading those areas as well. And now we're on to shoulder, arm circles even.
Yeah, windmills is what I used to call these when, being a young kid playing football. Do your windmills. And then I'll move that on to...
So windmills are great for getting some mobility and range of movement in your shoulder. Majority of us are very tight in our pecs because everything's so forward facing nowadays. So just opening them up is great. And now Tom's working on his thoracic spine.
And obviously stuck to your limit. If you're feeling something's uncomfortable, listen to your body. Don't push it past that level. This is quite a strange one. I was shown this by physio a while ago, and I've been through every single type of science or pseudoscience to try and help with my back, whether it be osteopath, chiropractors, physios, spinal surgeons. I've seen them all, and I've taken little bits to help. This one has helped. I don't really know what it's doing, but it just finds that, I don't know what this bit here is, right on the small of your back there. That's the only way of stretching that bit there.
So that's also one of Tom's dance moves on the dance floor. But that's the sacred, so right where he's pointing there, if any of you like art and you've seen sculptures of Michelangelo and the dimples of Venus, those are your sacroiliac joints. So what Tom's doing is he's kind of mobilizing his sacroiliac joints a little bit, getting some movement into that lower back.
So I would generally do this against the wall, but I'm going to use this metal here, and I'll do some side raises is what I would call this. I don't know if you call this something.
So I would call that neural flossing, side flossing. So often, if I've given patients injections for their back, I'll tell them to do this for the week after, every day for the week after, for 7 days afterwards. And it's flossing, it's creating space for the nerves that are coming out of the spine on the sides. So it's a really good one.
Okay, so that's the sort of upper body warmed up. Now I'm going to do some sort of heavier ones. So we're going to do some body weight squats. So I'm putting all the weight on my heel. I'm looking forward. I'm not hinging, okay? So 9 times out of 10, if I've hurt my back, I've got into this hinging motion, whether I'm gardening, whether I'm picking something up, whether I'm doing something with children. Avoid that position. That's the position that sets off lower back pain. 100% stay away from it. So everything I do now, I squat to reach stuff. It takes a bit of time to get the strength, but when it does come, it makes life so much easier. And when I feel like I've warmed up on those, and you'll get a few cracks and pops.
Tom, do you mind just showing the squat from the side on?
Yeah, great idea.
So you can see Tom's back is perfectly straight.
Okay, and then we're going to move on to lunges. So again, body weight lunges. You can use a little bit of weights, but again, just start off with body weight. You can do a going around the clock where you start going further round, but I like to keep it simple. So go forwards. And when I've done 10 of those, I'm going to do backwards. Trying to keep my body straight. If you feel any wobbles, there are areas that you need to work on. And then sideways ones, which are a bit harder.
You'll feel a nice stretch in your inner thigh doing that.
Yeah, that's right. Okay, so 10 of those again. Then we're going to move on to a Superman position, which looks simple, is actually very hard to be stable in this position. So we're going to raise our right hand and raise our opposite leg.
So as Tom does that, I can feel his muscles are firing. This is a really good one to do. It's a common Pilates exercise, this one, but it's you really need your posterior chain of your back to be working to keep that position and keep it nice and controlled.
I might do a few cat-cows, so if you've done yoga, but I would caution this if you feel that your back's a bit acutely in pain or flaring up. I'm just doing this as a stretch because I'm currently quite mobile. And then I'll move that down to what do you call this? What's the yoga position here?
Cobra.
Cobra. I'll go back up to my hamstring stretch I showed previously in a previous video. Hold that as long as I can. And then we'll do our pigeons. Again, please hold for much longer than this. It's just because I'm demonstrating.
Your length for holding it, everyone will have different lengths they're comfortable with. What I would say is when you're first starting to do these sort of exercises, don't hold it for too long because it might feel great, but then the next day you're probably going to pay for it. So it's about almost little pulses and getting into that moment, that position of discomfort, holding it for a few seconds and then backing off straight away. But Tom's been doing this every day for many years now, so he can hold it for a lot longer.
Okay, so on to press-ups next. So I can do press-ups, but if you're finding that's a little bit of a struggle, just go onto your knees, drop down. That's equally as hard. After you've done some press-ups, we're going to do some rotations. So arm through, arm out.
This is really good for thoracic mobility. A lot of people have restrictions with this because it's just such an unnatural thing to do now with the way a lot of our work patterns are, driving a car everywhere.
Yeah, so I would definitely say if you're feeling like your back's problematic, if driving is an issue, it tends to tire out, just make sure you can fit these stretches in at some point. It really does help to have that little bit of mobility between a long journey. Okay, so I'm pretty happy now then with my upper body, so I'm going to move on to my lower body a bit. So a bit simple here. We're going to do some bridges.
So great for glute activation. When you've had back pain, or even when you're training in the gym, you'll always hear people talk about glutes, strengthen your glutes, glute activation, so you can get the most out of your lifts. Tom's just doing some gentle glute activation here by doing the bridges.
And just concentrating on rolling the spine, so making sure the spine fully engages in both sort of positions. And then I might do just tucking into my knee to my chest, initially just lifting my leg up. And then as you get better at that, you can start raising your lower body up as well. This is a struggle if your back's recently gone, so you just have to build up to strength with some of these lower exercises.
It'll take quite a lot of core strength, won't it?
Yeah, I think something like Pilates is excellent to getting you started or seeing a decently qualified PT. And that's it. It takes me about 10 minutes. Do it once a morning. Grab a little espresso before, and that's me done.